Hi, my name is Haley and I'm a student in the School of Nursing. I have assessed and interviewed a patient that I will now present to you. The patient is an 18-year-old Caucasian female who is a current student at the University of Michigan. Her vital signs show a blood pressure of 130/85, a respiratory rate of 20, and a pulse of 72. The patient's chief complaint is recurring productive coughs. The onset of these coughs was October of 2015. The patient describes getting severe coughs that last for 5 to 6 days and says that they never completely disappear, however, they just vary in severity. The cough is productive with thick yellow phlegm. Aggravating factors are not drinking water as well as lying flat on her back. She has seen a doctor and was prescribed a Z-Pak at her first visit as well as Augmentin at her second and third visit. She was also prescribed an inhaler that she is supposed to take 2 times per day, but the patient states that this inhaler makes her cough worse. The only effect that these recurring coughs have on her daily life is that she doesn't go to the gym as much as she used to. I will now present to you the patient's health history. As a child, the patient had chronic earaches from ages 1 through 3. She also had recurring yeast infections from 13 to 14 years old. Her immunizations are up to date. Her allergies include apples, Motrin, ibuprofen, Advil, and seasonal allergies. She had an ankle surgery December 2013. During the surgery, there was tightening of ligaments as well as an arthroscopic drill into her bone for a bone defect. She's currently taking Zyrtec for seasonal allergies as well as the Augmentin that she was prescribed at her previous doctor's visits. Her functional assessment shows that she does drink alcohol 4 times per week, and the patient states that she drinks approximately 6 drinks every time she goes out. She does not exercise due to schoolwork as well as her current bronchitis. The patient describes that her eating habits are not the best. When I asked for a 24 recall of diet, she describes that she had brownies, pizza, ribs, and rice for lunch, a Kind bar for breakfast, and pizza, hummus, chips, and mac and cheese for dinner. She does not drink caffeine, and she does use personal safety devices such as helmets and seatbelts. The first system that I assessed is her respiratory system. During the review of systems, the patient denied any shortness of breath, history of pneumonia, or asthma. However, she does have a history of bronchitis. Her cough is productive as described earlier with yellow, thick phlegm. The patient does have frequent upper respiratory infections, and the patient denies pain or wheezing when she breathes. The patient also states that she has never had a mammogram or performed a self-breast exam. I then provided the patient with education regarding the benefits of monthly self-breast exams, as well as showed the patient how to perform one on herself. Upon assessment, I inspected the patient's thorax. The color was consistent and symmetrical. Her AP transverse diameter was 2:1, and there were no obvious deformities, injuries, or puncture wounds. Her breathing pattern did not seem distressed, however, it was deep and did make a slightly productive sound. Upon palpation, her trachea was midline and her posterior expansion was symmetrical. Palpation for tactile ephremitus was negative, and palpation of her ribs and thorax showed no abnormal findings. Upon auscultation, her lung fields anteriorly did show adventitious sounds of slight wheezing and rhonchi. These sounds were only found inferiorly on her anterior surface. Her lung fields laterally were clear. Her lung fields posteriorly showed the adventitious sounds of rhonchi. Bronchophony posteriorly was negative. Egophony posteriorly was negative, as well as whispered pectoriloquy posteriorly was also negative. The next system that I assessed was the patient's musculoskeletal system due to her previous ankle surgery. When I performed a review of her musculoskeletal system, the patient denied any joint pain, swelling, redness, warmth, or deformity of her right ankle, which is the one that she had the surgery on. However, the patient states that her left ankle is deformed, is often swollen, and does have a limited range of motion. Her right ankle also has a limited range of motion due to the surgery. However, it's much slighter than the one of her left. The patient states that her left ankle has hypermobility and that she sprains it often. There are no immediate effects on her performance of daily activities. The patient states that her left ankle is weaker than the right after her surgery because her left ankle is still deformed. The patient was originally scheduled to have surgery on the left ankle after the surgery on the right. However, the patient states that the recovery process was too strenuous and stressful for her to go through it again. The patient denies any family history of arthritis. Because the patient had ankle surgery, I only assessed the patient's lower extremities to see if her ankle surgery affected any change in muscle strength or range of motion in areas besides the ankles that were potentially compensating for her ankle weakness. Upon assessment, I saw that her hips had normal range of motion, had normal warmth, and did not have any signs of erythema, inflammation, pain, or crepitus. Her knees had normal range of motion and warmth, and there was also no signs of erythema, inflammation. However, there was slight pain as well as slight crepitus in her right knee. The patient had hypermobility in her left ankle, which is not the one that she had surgery on. She had no signs of erythema, however, there was slight inflammation and pain, which the patient describes as nothing more than normal. Her right ankle, which is the one that she had surgery on, had a limited range of motion with limited ability to plantar flex. There were no signs of erythema, inflammation, or pain. Her hamstrings had a normal muscle strength, and I would give them a range of a 5. Her quadriceps also showed normal muscle strength, and I would also give them a 5 on the rating scale. In terms of her ankles, her left ankle had diminished muscle strength, and I would give it a rating of a 3. Her right ankle had normal muscle strength, and I would rate it approximately a 5. Two other pertinent systems that I would assess for this patient is her cardiovascular as well as her HENT systems. The Lung Institute released an article in 2014 stating that chronic bronchitis can lead to COPD, which stands for chronic obstructive pulmonary disease. With bronchitis, the airways that extend from the trachea into the lungs become irritated. This disease leaves your lungs unable to work at full strength, making it hard or difficult to breathe, and eventually leading to COPD. The New York Times also released an article in 2014 relating chronic bronchitis to infections affecting mainly the nose and throat. The article discusses that the sputum produced can be bacterial and often creates infections in airways such as the nose and the throat. The patient also stated in her review of systems that she does experience frequent upper respiratory infections. These two sources indicated need for further assessment of both the cardiovascular and the HENT systems.